love that saying, when people say you are what you eat.
Yes.
I, many decades ago, had a lecturer who was like, it means nothing. You are what you absorb.
Totally. Yeah.
And it is true. Like, you don't have it until it's in your blood. So you can eat the best diet imaginable, but if you're not actively breaking that down and then you've got an intelligent membrane actively allowing you to absorb that, and you don't have bacteria getting in the way producing lipopolysaccharides that you're absorbing instead of your food nutrients, then you've got it. You've got it if you can digest it and absorb it.
Yeah. Hello and welcome to the Metabolic Balance Stories podcast. This is where we share real stories and insights to help you to understand more about optimal health, personalized nutrition, generally just getting yourself feeling better and looking better and operating better and having a wonderful future life. So I'm Cherry Wills, I'm your host, and I'm delighted to welcome my expert panel to join me today. And we have Araleena Isse, who is a naturopath, and Karen Pyke, clinical nutritionist. Both are expert metabolic balance practitioners and have a wealth of experience in clinical practice using metabolic balance and navigating all things natural medicine and natural health. So a big welcome to you today.
Thank
you.
Thanks, Jerry.
So what we're talking about today, guys, is gut health, aren't we? So we wanted to do a bit of a deep dive into the importance of gut health. We're going to be touching on the microbiome and importance of fibre, digestion, and all of that. The essentialness, because I said that's what we do. We use food, so food has to be digested. And so we have to have a healthy digestive tract. And I think one of the things that I have noted throughout my clinical practice is just how quickly gut health is actually impacted as soon as we get the food right. Araleena, I know you were saying a little comment just before we came on air today, just the importance of food and how quickly it also you see it in practice too.
I sort of think about people's health a little bit like a tide. And when I use metabolic balance, it's like suddenly instead of being deluged by the health and the problems are just coming in and coming in and coming in, it's like the tide goes out and you have this clear insight into what's going on. And I think a large part of that is, the biggest immune challenge that we face is the consumption of food. The biggest daily sort of job our body has is to digest and direct food, and to turn food into us. And so getting the food right, and not just right in the sense of a good diet, but right for that person, it creates a very unique space to then help them with other sort of more entrenched health issues that they might have.
Yeah. Because gut health is often one of the biggest things that people do suffer from, poor gut health or IBS, constipation, diarrhea, bloating, discomfort. It's a big thing that is in a lot of people's day-to-day lives.
I was just treating somebody yesterday. Sorry, Karen. Treating somebody yesterday, and they shared with me, they go, I've just realised that every day I had a complete explosion on the toilet round about the same time, and I thought that was normal. And now I know it is not normal.
Yeah. Karen, it's something what would you say here?
Yeah, look, it's really interesting, isn't it? Because gut health is such a big, huge topic. It is everywhere. And I find that there's the clients that come to you with gut issues, so the IBS or the altered bowel motions and things like that. And then there's the ones that come to you for something else. But when you actually delve into a lot of what else is happening, we still go back to the gut. And like it's funny because like I remember a time going, I always say it always goes back to the gut. It always goes back to the gut. It always goes back to the gut. But it really does. Like you said, like the foods we eat are the foods that fuel us, the foods that make us feel great, and they've all got to be digested. And when the gut's not right, if we're just not fueling ourselves correctly, the gut will tell us. It's listen to your gut, listen to what your gut's telling you. And if it's not feeling right, something isn't right.
Yeah. And it's just a something that a lot of people suffers quietly, privately, saying, okay, this is well, this is my normal. Actually, that's how I used to be. I've shared before my early, my early years before, up until I was sort of mid-30s, really. I used to have a lot of digestive issues, and I always used to say, well, this is my normal. So I'll only if it changes from being this normal, sort of, that I will actually get worried but actually then when you realize that's not normal to have this kind of, IBS pattern of discomfort. And I think if we start off as well, just really sort of talking about the gut microbiome, because as in a research topic though, this is really taking precedence today, isn't it? The last 5-10 years has seen an absolute explosion in research into the impact of the gut microbiome.
I think we're only just starting to really understand it as well. Like I think we've said on other podcasts that nutrition research, science has been around for such a short amount of time. Well, the research in the gut microbiome has been around for less time. And we're still going to keep learning. Like we're going to keep getting more and more information, which is just amazing.
I was going to say as well, we're just developing the technology to be able to really see what happens, or where are people's gut microbiomes as a baseline, and then what happens when we start changing what they eat, and does it happen to everybody? And microbiome research is fascinating, and especially people that have inflammatory bowel disease, people that have constipation or diarrhea. We see similar patterns. And we want to be able to change and support that pattern. But in my experience, being a metabolic balance practitioner, I could change things when I was giving people a lot of supplementation and herbs, but it would always go back once they were not taking that. Once the herbs and the supplementation wasn't holding their microbiome in that place. And then that's when I realized I need to make a more profound change to what people are eating. And that general diet advice or just eating well didn't cut it. It just didn't cut it for most people. And in fact, I could implement inflammatory bowel diets and they were not really fully addressing what was going on. But since being a metabolic balance practitioner, I have a lot of inflammatory bowel clients, and I find that the ability for metabolic balance to control these people's inflammation, which is depending on what type of inflammatory bowel disease you have, but is often really driven by microbiome. I'm quite amazed at the once we make it individual and unique to that person, and once we start getting very specific. I love the specificness of metabolic balance. You don't have to guess anything. You know exactly what to eat, when to eat it. That's when their gut inflammation levels start coming down and their good bacteria start going up.
And I think it's that recognition that the gut microbiome isn't just limited to the health of the gut. It actually has far, completely systemic whole body influences There was this 2025 research that I was looking at that showed that the different metabolites in the gut microbiome from the gut microbiome can impact arterial buildup, so as in heart health. So if you don't have the right gut microbiome, you also are at increased risk of cardiovascular issues. And it's why, again, coming back, you've got to come back to your food. You've got to come back to how you are actually digesting your food, because that influences the microbiome, which influences other organ systems and susceptibilities.
I think it's like understanding that the small intestine is a highly permeable membrane. And when it's full of food that's being broken down by enzymes and hydrochloric acid, that those tiny molecules of food are being rapidly absorbed over into the blood. But if there's a whole lot of bacteria that we don't want in that small intestine, then the poo of that intestine will be rapidly absorbed over and into the blood. If the small intestine is not functioning how it should and isn't filled with what it should be filled with, and the same for the large intestine, then we have all sorts of complicated systemic impacts: brain fog, fatigue, poor sleep, anxiety, but then also, cardiovascular health, nervous system health, systemic inflammation.
Yeah. The gut brain axis kind of comes to mind when also you're talking about that brain, foggy thinking and cognitive function, nervous system. That gut brain action is incredibly powerful. It's very fast. It is incredibly highly influenced. It's a chicken and an egg as well situation. What comes first?
It's really interesting. I can even notice in myself as well that, look, I certainly follow the metabolic balance principles in my day to day, but especially coming off the back of Easter, when I'm not sure when this podcast is going out, but we have just had Easter, and coming off the back of Easter, there has been more sugar in the house. And the one thing I sort of say, and I say it about myself, is when I eat sugar, I literally cannot concentrate on the words that I need to say. And that sort of, I've fed the gut all of this sugar that it really doesn't like. And then I know what I want to say. The words are there, but I literally can't get them out. I'm like, oh, what's that word? What's that word I'm trying to think of? And as soon as I clean out that sugar, everything comes back. It's like, it is absolutely fascinating when you feed the gut and the microbes and everything we have got down there, the beneficial bacteria, you feed them what they need, the body the connections come back.
Yeah. There's that phrase that that the gut brain, or the gut is the remote control for the brain. As in, if you support the gut, you're immediately going to be controlling the brain that much better.
Yeah.
When we talk about fibre as well, so we know fibre is a bit of it's a buzzword. Everybody talks about the importance of fibre. What would you say that we're looking at there?
I think it's really interesting how we used to think about fibre and how we now understand fibre. Because remember, there was, ads for fibre back in the 80s, and they'd be like, it's an intestinal room. It just swings everything out, because we were convinced that it was the fact that we didn't digest it and that it sort of just did a little sweep.
It was that kind of thing that it didn't really interact as well. It was a very much a just sort of a push it through and that's all that happens. No interaction.
Fibre is all about your gut microbiome. It's all about it, because you don't digest it. You don't break it down and absorb its little parts and then use them. It largely moves into the large intestine undigested, where it starts to be acted on by bacteria. And particular fibres are acted on by particular bacteria. And it ferment. So in the large intestine, this is where we ferment all the expensive stuff. We ferment our CoQ10 in the large intestine. We ferment our serotonin, our like the tryptophan, and it's where vitamin K. It's where a lot of the good stuff is produced by our body if it's got the right things to ferment.
I think there's so many, again, that the beneficial bacteria that's there influences so much within the body. So like our immune system, our hormone production, sort of all of that is also influenced from there. And we need that fiber to feed all of that good bacteria so we can actually strengthen those immune, like our metabolic health. We know that we can influence that by the fiber we eat. Whereas I think, fiber previously was, if you struggle to go to the toilet, just have fiber. Like that was what we thought of it as, like years ago. Whereas now fiber has a function in the body. And a lot of people get scared of fiber as well. It's like, oh, I can't have any fiber in my diet. And like we all need it. And I love that MB allows that.
And we need the right ones. We need the right stuff in the right quantities. And it's the research that is increasingly showing how it interacts as well. I think that's what I love reading. So we know that sort of oats and it can be a great soluble fiber, but actually there was some research that talked about the oats and the yogurt really supporting true beneficial shifts in that microbiome composition. And, those are actually some key staples that we have been recommending with Metabolic Balance for years and years, but we're increasingly seeing the evidence that's just finding new ways that show that how powerful that these foods can be.
I think it's really also important to think about fiber from the blood glucose perspective as well.
Yes. Yeah, absolutely.
Fiber usually will have a bit of a carbohydrate component, but it's really hard to break down. So it's a bit of a workhorse for your body, so that glucose and it impacts other glucose that's in the gut at the same time. It slows the release of glucose into the bloodstream. So instead of having this sort of like steep incline that gives you a little bit of high blood glucose and then a dip that makes you feel shitty on the other side of it, you get this nice wave.
Yeah, by controlling that, you're controlling that inflammatory response within the body as well.
Yeah.
Yeah, it's coming back to the holistic approach. It's not just one thing that something does, or that food and balance in our diet does. So it's the knock on effect. But what came first? Everything is of equal importance in so many ways. From what I see.
I think with fiber, like a lot of the fiber that we can get from our foods, that what I found with my clients is that very few, if anyone, reacts to the fiber within the food. But I've had clients that have come to me previously that are taking additional forms of fiber. So like psyllium husk. Psyllium husk is not a bad thing, but for some people, their bodies just cannot work well with it. And they've actually come in and they've been bloated. And when we've kind of got down into something, it's like, oh, yeah, take psyllium husk. And we've stopped the psyllium husk. We've used the foods or different forms of fiber, and they feel so much better. So, like that individualization, that personalization that comes with everything that we do with metabolic balance can be applied to the fiber as well.
A lot of fiber choice, I feel, relates to transit time. A while back, I started doing a transit evaluation of most of my clients, and I was really surprised by how many people had a very, very slow transit time, even though they were having a bowel motion every day. The time that between eating something and it coming out the other end was sort of 2 to 3 times what it should be. And that when we have that really slow transit, that's when we can over ferment, get very bloated, not be excreting enough, because the bowel's a big part of how we get rid of everything that we don't need. And once I understood how transit time was impacting people's health more, then it made it so much easier to pick the fibre that they needed. Like people with slow transit time, you give them psyllium and it slows that transit time down even more and they feel worse. People with super fast transit time, you give them psyllium and they feel great. And so that understanding of what is actually driving this problem, and not giving a blanket answer, actually giving this nuanced answer makes all the difference.
A quick thank you for listening to Metabolic Balance Stories. We aim to bring you a bit of positivity and encouragement to help you eat well and feel your best every day. If you're enjoying this episode, hit subscribe so you don't miss the next one. We'd really appreciate it. Right, back to the conversation. I mean, that's what personalized nutrition and personalized medicine is actually about, isn't it? It's really talking to a professional who's going to, say, okay, I think we need to try this, or what's, because you can assess so much from just really good health history taking and understanding really what's going on.
And like a transit time test, I get people to do it at home, costs nothing.
Yeah. Is it like eating a can of sweet corn? So, yeah. So, if anybody listening, this is really where you eat some sweet corn and note the time, and then you just monitor when you start to see it come out the other end. That is this beauty of this simple transit time test.
And sometimes you'll see it all come out at once. Other times it'll take a while. Don't eat more sweet corn. Wait.
Yes, absolutely. Yes, it's a one-off sweet corn. I mean, I would even say eat sweet corn once in a fortnight, as in like just really give it a full, because you just never quite know and how.
A 2-week test. I've had it.
Yeah, exactly.
Come into my clinic, and that was something who had a bowel motion every day.
Yeah. The intestine is a gosh, I don't know what the actual statistic is off the top of my head, but it is an incredibly long tube in effect that wraps all around itself. And so you never quite know the personal intricacies of where all the little pockets and where where things can get held up in that tube as they're flowing through. So it is pretty fascinating to do this.
And that's really interesting because if I've have a few patients who have then gone on to do the smart pill. So a little smart pill that you swallow, and then it actually tracks exactly how long did it take to get from the mouth to the stomach? How long was it in the stomach for? How long did it take to get from the start of the small intestine to the end of the small intestine? How long did it take to get out? And also, was it delayed anywhere? But interestingly, what I discovered through that process was that the corn test is considered equal in terms of total transit time. So they'll usually do the corn test with people before they do the smart pill, because the time in which it takes the corn to get through will be the time it takes the smart pill to get through.
Well, that's because it's going through the same system. it's going through the same pathways. Yeah.
Accurate total transit time evaluation, and that's well established now.
Yeah, that's fascinating.
It's fascinating. Have you done any tests on people pre-metabolic balance and post-metabolic balance?
Yes. And what I find is that without me having to use herbs or nutrients, a lot of people, their transit time will naturally balance. Sometimes they need a little bit of support. As we know, once you start changing, especially if it's a huge change in food for them, but that I have people who have never been able to come off fibre support pre-metabolic balance. That once their gut really settles down to digesting the new diet, that they don't require additional fibre, or not a medicine type of fibre. So, as we know, we're often adding food fibres to metabolic balance. Often be picking certain foods and helping people navigate how much fibre they need. Especially, I monitor people's blood glucose levels. And since I started doing that, I noticed that some people will have a blood glucose dip between, say, 2 and 5 a.m. And what I found is that fibre during the day and at night is very within their food is very important for managing that nighttime dip in blood glucose.
Yeah. I think it just shows that, the how it can slow things down or just balance that blood sugar sort of release and management. We need to do these things consistently. I think that's the always the take home for me, is that once we are just this beautiful rhythmic clock at the end of the day, and all of our body is this rhythmic clock that wants to flow through our 24-hour cycle. And so our food and our nourishment and how what we're including in all of that food and nourishment needs to go with that consistency and that balance.
Again, that goes back to one of the benefit of metabolic balance, in that we have that consistency. Like, even like my clients, if I'm like, every time they come in, we have a chat about what they've been eating and the timings of day they've been eating, especially with around their work schedule. And it's amazing how consistent people become. Like, that rhythm, that natural rhythm comes in with the foods to allow the body the balance.
I think it's so interesting that our society is so obsessed with socializing and food, and the impact of socializing on food on the way that we eat. Like, brunches, dips and alcohol in the early afternoon, and things like this, that we change the way that we eat in order to socialize often. But that's just a complete concept, because in fact all that time our body is here going, oh, when do I need to make the digestive enzymes? When do I need to warm the stomach up with a bit of hydrochloric acid? When do I? So our whatever we think we would like to do from a social perspective or a work perspective, our body continues to need what it needs. And the evidence is that your body wakes up at a certain time. It's ready to eat at a certain time. And more than that, that health is training your body to be ready. So having a rhythm to your life, having an order to the way that you deliver food, so that your body's primed and ready for it so it can digest it.
Yeah, I think that's really such an important point. I always think back to when my boys, I've got two boys, and when they were little babies, they're grown men now, but when they were little babies, when I stuck to the rhythm that they liked, that the babies liked, when I kept to sort of 3 hours of feeding and 3 hours of sleeping, and then, that sort of a real rhythm and predictability for them, they were very content little babies. But as soon as I tried to rush them or change things or try to do things, the way, just no, we have to go here and change their routine, they became quite cranky. And the reality is that the human body, we work naturally well on a rhythm. Now, this does not mean we can't be sociable and we can go with the flow, because as soon as we do get stronger and greater health, we are going to be more resilient. We're going to be more flexible, and things are going to become very much more possible. But we equally have to realize that, yeah, brunch every Saturday, that change isn't always the best thing to do when our body is used to having a nice breakfast, followed by a break and then lunch. Suddenly to shove a meal in the middle of that and then expect you to feel fantastic on that sudden change, you've got to stop and think, oh, is that why I'm actually a bit tired on a Monday morning? Kind of pushed yourself.
Afternoons are just a blur.
Yeah. 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 Absolutely. But we're going a little off topic because we were talking about the gut. This is what happens. We always tend to go off topic.
I think it's still relevant to the gut though, because because we feed the gut regularly, so the gut knows when it's going to get fed. And then when we go out of our rhythm, we are actually forcing the gut to go out of rhythm as well and go out of balance. And it's affecting the bacteria. The foods that we select at those times when we go off are probably very different foods to what we would normally have. And then all of a sudden, the gut's just not prepared for it. And we see the dysfunction that comes in again.
Yeah, I mean, everything comes everything comes back to the gut, no matter where we go. But the other thing I really wanted to touch on in this session was the importance of that gut barrier integrity. The phrase that I think has been banded around on social media in various circles for 20 years or more is this term leaky gut. A lot of people can talk about leaky gut. Now, obviously we really need to say, that gut integrity, intestinal permeability. Leaky gut is more of that sort of catch-all phrase of, but Araleena, would you just like to share, talk about that importance of gut-brain integrity and what leaky gut really is?
So I like to think about it as, I think I mentioned it before, we've got our small intestine, and that's where the stomach is delivering the masticated food. And
the chewed food. So, yeah, the chewed food.
All chewed, it's mixed with hydrochloric acid and also some digestive enzymes, and it gets pumped out in little blobs into the small intestine. And then in the small intestine, we're getting these little villi and more enzymes, and it's sort of squidging into that digested food. And what we're aiming to get is that we can rapidly absorb the nutrients, vitamins, protein, and glucose over into our bloodstream, because that's how we build ourselves. And so it's a highly permeable membrane. It should be very slick. So bacteria shouldn't be able to adhere to it. Any bacteria that survive the hydrochloric hit in your stomach should just be like sliding on through. And, it's very selective. We want it to be healthy, fresh, selective. So the body's very intelligent. It will be pulling out what it needs. And we want to enhance that. And that's what I see Metabolic Balance doing. It takes a lot of weight off the digestion and it simplifies things. And then what we're really wanting to make sure is that you have enough building blocks in your food so that you can maintain that that barrier, that beautiful selective barrier, and you can maintain your villi, which are your little fingers sticking off the barrier that are where a lot of this enzymatic reaction goes on and the breaking down of the food so that you can absorb. And really, I feel like leaky gut is a patient-friendly way of describing the gut itself, not just what you're putting in it, but this lining of the gut working optimally. And I find a lot of the time it's because people sort of go, oh, what am I looking at here? Am I looking at like a cheese grater effect, or like what would leaky gut look like? But it's more a function, that it's not acting intelligently and selectively. It's being run by what you're sticking in it, and it's no longer intelligent.
Yeah. So we're intentionally looking at the barrier that in that small intestine that determines what nutrients and all the different components of our food, how it can be used by the body, and how we want it to go preferably to the liver and be all go through the proper processes. But it can, in some instances, where that gut barrier integrity can really start to break down, it can lead to it entering the bloodstream, which then can lead to all sorts of immune responses where we don't really want it to. And that can cause sort of increased inflammation and numerous different problems systemically around the body. So when we're looking at it from that point of view, I often, we need to have great food to restore the gut barrier, but we also need the barrier in place to make use of the food as well.
I explain the barrier, like the leaky gut, with my clients. I sort of explain that, like, we are just made up of cells. That's what we are. We're so many cells that come together. We have cells that sit on top of each other, and we have cells that sit next to each other. And in our gut, we have these tight junctions, and they're like little fingers that they stick together, and they keep everything nice and tight, and they're stuck. And as we don't look after our gut, they start to open a little bit, so they can't hold on as tight as they used to. So therefore, the leaky gut sort of happens more. So although we have nutrients that sort of go to different places, there's ones that we don't want to go out, the bacteria and the toxins that enter the bloodstream. So we've got to use the right nutrients to make sure that as we have to keep ourselves strong and healthy, we've got to keep all these cells nice and strong and healthy. So we've got to feed the body the right foods to make sure we can keep that integrity.
Yeah.
A little bit like, would you throw stones into your washing machine and then pop your best jeans in and stick it on and put it at 90 degrees? No.
And I think, it used to be quite a sort of a fringe concept, this idea of leaky gut. But it is really the research over the last 20 years or more has really brought it to the forefront of gastroenterology, that they fully recognize increased, intestinal permeability really can lead to all sorts of issues, including, liver issues, obesity, diabetes, and the gut brain barrier, not the gut brain superhighway. So we're also talking about people with increased risk of nervous system and mood disorders when their gut integrity is not in place. So bringing that as an important aspect, that what you are eating is vital for restoring this balance and restoring the integrity.
I really love that saying, when people say you are what you eat. I, many decades ago, had a lecturer who was like, oh, it means nothing. You are what you absorb.
Totally. Yeah.
It is true. Like, you don't have it until it's in your blood. So you can eat the best diet imaginable, best, but if you're not actively breaking that down and then got an intelligent membrane actively allowing you to absorb that, and you don't have bacteria getting in the way producing lipopolysaccharides that you're absorbing instead of your food nutrients, then then you've got it. You've got it if you can digest it and absorb it.
Yeah, exactly. It is that. It's the classic thing of let's get back to what we're eating, and then really get the food right. Get rid of the foods that don't serve us, and then see how the body responds as well, which is essentially what we do with personalized nutrition. Let's find the right foods, and then let's move forward and see what happens.
And not just what you're eating, but when you're eating, how you're eating.
And I think it's really important to kind of talk about it as well and sort of mention that, like, obviously, like if somebody has had IBS type symptoms for a long, long time, we're not looking for a quick fix. We're not going to go, if you eat this today, you're going to feel better tomorrow. It can still take time to reestablish a really healthy gut. But I have to say, with metabolic balance, the results are quite staggering with how quickly we will see an improvement. Like it literally is a matter of weeks where I see that first client that's come back that's had this terrible issue for such a long time, and they feel so much better because we've got the food right, because they're eating the right way, because they're drinking the right amount of water. They've got the support of their practitioner that's also helping them with any lifestyle changes and things like that as well. That I guess people shouldn't suffer. Like, it can be changed.
That's always what I would love to get across with anybody who might be listening, is that it really can be possible to change things around. The gut is one of the fastest reproducing cells in the body. It actually wants to, it will restore balance really quickly when it's given a true opportunity to do so.
Agreed. You can get so much change in a really short period of time. I noticed that too, Karen.
Yeah, you really can. Right, so thank you so much. I think that has given a really good, we could carry, like we said, it all comes back to the gut. So we could actually carry on chattering on this for a good, twice as long. But I think, hopefully people realize that, your food makes a massive difference to the health of your gut. And the health of your gut makes an enormous difference to your entire holistic whole body health and future and energy and, well-being. And we know that when that gut is compromised, when things aren't right, we feel it. We feel it in our whole bodies when something isn't right in the gut. So, really let's pay attention more, pay attention to how we're feeling on that flow through the body. And it is incredible how things can shift and change and rebalance when they're given an opportunity.
How straightforward making this shift can be. Often when I'm doing just like a free chat with somebody, that they'll be like, "Oh, I just don't know if I've got the time, if I've got the energy, if I've got the willpower." And actually today, every single time, a couple of weeks later, they're like, "Oh, it was a lot easier than I thought it would be."
Yes, because life is also a lot easier when your gut is feeling a hell of a lot happier. Life again makes it so much easier to do everything.
Absolutely.
Thank you, ladies. It's been wonderful to chat to you again, and we will catch up again soon and unravel further essential insights. But for now, thank you. Much appreciated. And if anybody would like to hear more about Metabolic Balance, you can check out the website, and you can also find details of getting in touch with Araleena and Karen as well, who are, fantastic Metabolic Balance practitioners working with clients in their clinics every day. So thank you to both of you, and we will catch up again soon. And hear more Metabolic Balance stories.
Thank you.
Thank